Hello everyone. You are watching Medtalks with Dr. KK Agarwal, non-stop show 299th edition and cumulative 2509 edition. I am Ankit Ahuja, his son-in-law. Just to start off, I'm going to give you a quick update on Dr. KK Agarwal's health. As you all know, he's been battling, COVID-19 complications in the hospital. And this time, we need all your love and support, and we will keep you posted on his further health updates. So let's have the headlines for the day. The US is looking at joint production of Johnson and Johnson's COVID-19 vaccine in India and ways to help manufacturers like the Serum Institute of India to boost production. Active COVID-19 cases in India have decreased for 3 straight days for the first time since early March, as has the 7-day average of daily cases, both indicating that the country may have reached or is closing to reaching the peak of this devastating second wave. First dose recipients of Covaxin don't need to restart their vaccination schedule if the gap between doses goes beyond the recommended 4 to 6 week interval, a top public health official said. Expert also stressed that delay in taking a second dose of Covishield or Covaxin does not render the first shot ineffective. Bharat Biotech's COVID-19 vaccine, Covaxin, was recommended by an expert panel for phase 2 and phase 3 clinical trials on those aged between 2 and 18 years. The trial will take place in 525 subjects at various sites, including AIIMS, Delhi, AIIMS Patna, Mediterranean Institute of Medical Sciences, Nagpur. In the wake of a rapid spread of COVID-19 infection, ICMR has altered its testing strategy to recommend increased use of rapid antigen tests, mainly to upscale field testing to detect cases early and isolate them to reduce the transmission. So these were the headlines. So let's go to the topic of the day. So now let me introduce our special guest, Dr. Gargi Kandhari. So Dr. Gargi, she's the MDS, conservative dentistry and endodontics. She's an endodontist running her own practice in GK and Vasant Vihar in Delhi since 10 years. She has worked extensively in both the private and government setup. She is a keen aesthetician, and her area of expertise is aesthetic dentistry and transforming people's smiles. Welcome, Dr. Gargi. Welcome. We are very happy to have you on the show.
Thank you so much. Thank you for having me, Ankit. I hope you're doing well.
Yes, we are well. So, Dr. Gagi, I would like to request you to, start with your presentation, and then we can move on to the questions.
Sure. Ritu can put the presentation. Is the presentation on?
Yeah, it's going to come, yes.
Okay. Okay. So today I would like to talk a little about the oral aspects or your mouth when it comes to COVID. Unfortunately, it is one of the most underreported areas, and the main reason for that is, if you notice, since the onset of the pandemic, we've all been in mask. So nobody wants to take off the mask of a COVID positive patient, so we miss out most of the oral signs and symptoms. Whereas in the mouth, there are a lot of symptoms which are there, which in fact set on early, and we miss them and we never get to know them. So one of the first and the easiest thing to notice in our mouth is loss of taste or ageusia. In fact, there are studies which now say that a loss of taste is almost as confirming as a positive RT-PCR. This is one of the first symptom. Then the next slide, please. Okay, now there is a thing called as a COVID tongue. I would not say that this is an medical classification as yet, but there are many reported cases. In fact, in the British Journal of Dermatology, they've even carried out a study wherein the tongue swells up. There are bumps, ulcers, there are areas of the tongue which become bald, there's burning sensation. The patient will have all these symptoms and will be completely unaware that he or she might be COVID positive, because there might not be any other symptoms, because this is one of the earlier symptoms. Now we are seeing this increasingly in a lot more patients. So this is something to look out for. If you feel any kind of swelling, discomfort, you should definitely consider getting yourself tested or talking to your doctor. Next slide, please. Okay. So the other thing is, again, now along with the, as I mentioned in the previous slide about the COVID tongue, there's something known as ulcers, macules, and papules, which we have been seeing in patients. There are several studies. There's one study in Spain where they examined the mouth of COVID positive patients, and they saw these painful, uncomfortable ulcers. Now, I wouldn't say that only ulcers means you've got COVID. No, it could easily be one of the signs and symptoms along with the other things. But yes, this has been seen in patients, and there is further reporting that is required, but again, one of the things to look out for. Next slide, please. Okay, so now these were few of the symptoms which we can look out for in the oral cavity. Now, other than this, there are a lot of side effects of this disorder which we see in our mouth, which which is again not reported a lot. There's something known as dry mouth or xerostomia. Now, this is very common. Your mouth will feel dry. You'll have discomfort. You will, have difficulty in swallowing. Your lips will feel dry and chapped. This could be due to various reasons. One of the common reasons is because this is a respiratory virus. The patient, has a cough, a cold, and inadvertently starts breathing from the mouth. So the mouth becomes very dry and it's uncomfortable. The second thing is certain drugs which are used in the treatment of COVID, like antivirals, like interferons, they cause dryness in the mouth. Third, many a times the salivary glands which produce the saliva are affected in this infection. So yes, this is something which is like a side effect which can be there during the period of infection, and in some cases even once you have recovered from COVID. This is something to look out for too. Next slide, please. Okay, so cracked and sensitive teeth. Now, this is not directly related to COVID, I would say, but this is very common. This is something which I have been coming across a lot. I have a lot more patients now complaining of sensitivity in their entire mouth. All their teeth are feeling sensitive. They have fractured, crack हो गया उनके दांत जो पहले कभी नहीं हुआ करता था. The reason for this is stress, anxiety. We are all locked up at home. We are not working. People have log apne daat, they've started grinding, and so this is something which I would say is a very common side effect. And almost every second patient tells me that suddenly mere sare daaton mein dard ho raha hai. My teeth are chipping off. This is all because of grinding, stress, anxiety. Next slide. Lastly, now here I've put an oral picture because I'm a dentist and these are the things which I'm concerned with a lot. Mucormycosis, black fungus, which has become very common. This can happen during the infection and post-COVID. So what happens is when the patient recovers, suddenly the symptoms to look out for is acute dental pain, which will not subside, sinusitis, headache, swelling around the eyes, kabhi blackish discharge from the nose, jo pehle kabhi nahi hua hai. This is very strange, but this indicates that you have mucormycosis and you should immediately consult your doctor. Whether आप डेंटिस्ट से बात कीजिए या अपने ENT से बात कीजिए, क्योंकि एक बार this starts, it spreads very rapidly and it is very difficult to control it. Well, a few things can be done. ये सबको नहीं होगा. It's not that every person who's got COVID will get mucormycosis. No, ये ज़्यादातर देखा जाता है highly diabetic patients में, जिनके sugar levels are not in control. Secondly, we also see in patients who are on ventilator support for a long duration, long-term steroid therapy. ये COVID के बाद ज़्यादा देखा जा रहा है because steroids, antibiotics are common in the treatment of COVID. So this can also affect. And fourthly, which is very important, जो मैं सबको बोलना चाहूँगी, a lot of us are using now oxygen concentrators in our homes, in our houses. You should never ever use a concentrator with tap water. Ideally distilled water होना चाहिए, if not boiled or filtered water. Tap water is a very common source of this fungal infection. The concentrator की tubing should be regularly cleaned with soap and water and should be changed regularly. ये छोटी छोटी चीजें हैं, but these need to be taken care of. If you're a diabetic, you've had COVID or have recovered from it, please make sure कि आपके sugar levels are under control. Your immunity is very important. The moment immunity goes down, this fungus sets in. So yes, this is something which is of concern and which is on a rise. And this needs to be, the most important thing is to identify it, be aware कि ऐसा कुछ हो सकता है, and to consult your doctor at the earliest before it becomes serious. So yes, so these are the few of the things which are related to our mouth, हमारे oral cavity से, which is associated with COVID. And yes, so that is what I wanted to tell. And I would be happy to take any questions.
Great, great. Thank you, Dr. Kagi. That was really informative. So we just, we have a couple of questions that we just want to put out to you. And as the viewers also ask, I will shoot those questions as well to you. So the first one, how do we take care of our oral health at this time? What is the first thing that we need to do?
हाँ, so the first thing that you need to know is that कि आप अपने डेंटिस्ट के पास जा नहीं सकते very easily. Most of the dental clinics are shut. हम सिर्फ emergency cases देख रहे हैं, and for your safety you should avoid going at this stage unless and until कि कोई emergency है. So you have to take care of your oral health. Very good brushing, flossing. Use an antiseptic mouthwash. I would say a povidone iodine, betadine mouthwash regularly, or a chlorhexidine mouthwash. इससे क्या होता है, our oral cavity is healthy. We reduce the chances of getting an infection, going to a dentist, and avoiding stepping out basically. Yes.
Okay, and so if you, for example, if you develop an oral infection while you're at home and you're in the middle of a lockdown, or you have an abscess, will it lead to worsening or COVID spread? What are your thoughts on that?
Yes, definitely. So unfortunately, हमारे mouth में, when we have an infection or a pocket or an abscess, I would say simple terms में कि वो एक gateway बन जाता है. From our mouth, if there is an abscess or a pocket, वहाँ से infection can straight reach into our lungs. So please, if you have an abscess, you have a pocket, you have an infection, address it. आप जा नहीं सकते डेंटिस्ट के पास, उनको कंसल्ट कीजिए, मेडिकेशन स्टार्ट कीजिए, ट्रीट इट एट द अर्लीस्ट. So yes, so and if you have mild COVID and you've developed a periodontal abscess or a pocket, it can lead to worsening of the infection.
Okay, and what kind of ointments do you suggest one should have at home to combat oral pain or discomfort, especially when you can't visit the dentist? Is there some like a kit we need to keep ready at home?
Yes. So firstly, most important, dental pain बहुत बुरा होता है. It's excruciating. So you should have very good painkillers. I'm not promoting any particular medicine, but what I generally prescribe to my patient is you should have either Ketorol or Ketonov. Is a very effective painkiller for dental pain. You should have some antibiotics at home. There are some gels available like Ora. जैसे COVID में हमें बहुत commonly ulcers देखे जाते हैं, क्योंकि there are various reasons. It is not कि you have COVID तो आपको ulcers है. Ulcers happen due to stress, anxiety, repeated infection. COVID, affects our immunity. So when our immunity goes down, we get oral ulcers. So for that, there are various gels like Orasor, Dolo gel, Mucopain. These are very easily available, and you should definitely have them at home. Probably, I would recommend that don't start on oral medications without once having a word with your doctor. But yes, you should have them handy, definitely.
So, doctor, are there any OTC products also that one can take or keep at home?
The most important thing I would say कि as a maintenance, start using a mouthwash. Use a povidone iodine or a betadine mouthwash regularly. Flossing, brushing जो मैंने आपको पहले कहा है, उसके अलावा there are some gels जैसे Mucopain करके एक gel आता है, which is a numbing gel. Supposing you're in acute pain, you can't talk to your doctor, you can apply that over there. Then there are some steroid oral gels which are also available. The triamcinolone gels which will give you a lot of relief in case of any kind of ulcers or eruptions in your mouth. So these are small things to keep Dolo gel, which are very easily available, and it's a good, it's a good idea to have them with you at this time.
Okay. Okay. So, doctor, tell me about, like how you had mentioned lockdown and we're going to keep some like kits in handy. But
Hmm.
at the end of it, we've always heard that you should always visit your dentist every 6 months. Now, okay, first, why that? And, how do you manage this during the lockdown?
Very difficult. So I always tell my patients कि 6 महीने में एक बारी आपको आना ही है. इसकी reason ये है कि not just for it is basically a checkup. Like how if you have deposits on your teeth, if you have a small cavity, if you're visiting your dentist every 6 months, you prevent worsening of your problem. Most people in India, they come जब उनके दांत में दर्द होता है. तब तक the situation has become bad. Then by then you need extensive treatment, a root canal,
Yeah.
extraction. So to avoid that, it is always a good idea that once in 6 months visit your dentist, get a cleaning done. It will be better for you also in the long run, and you'll avoid any extensive treatment. Of course, in the lockdown, हम ये चीज कर नहीं सकते. So what we have to do is we have to take better care of ourselves. Other than the oral hygiene, जो I've already mentioned, there are few things like avoid excessive sugar intake. Things जिससे आपकी oral health worse होगी should be avoided.
Hmm.
Excessive snacking, excessive sugar intake, stay well hydrated, have a diet which is healthy, nutritious, has high calcium levels, so that you on your side are doing everything to
Yeah.
avoid doing, right now. But yes, once the situation improves, my advice is always that you should visit your dentist once in 6 months.
Okay. And so that's about the adult. So when does a child, like a young child, when should they start visiting a dentist, for their regular checkups?
Okay, so ideally, according to the book, as soon as the first tooth erupts. But as parents, हम ले नहीं जाते, especially in our country, most of us don't take our children to the dentist, which is not right. I feel as soon as the child turns 1+, he or she should have their first dental visit. For no other reason कि एक तो उसकी checkup हो जाती है, दूसरी चीज उसका जो fear है वो निकल जाता है. When you get
Hmm.
a child in pain, crying and screaming to a dentist, half the battle is lost. The child is so scared. Then they sit on the
Yeah.
dental chair, and then the treatment becomes much tougher. Rather than a child जिसे पता है कि मुझे साल में एक बार या दो बार ही जाना है और डॉक्टर को दिखा के आना है. So
Hmm.
yes, other than the rest of the world, they have a regular visit every 6 months, which is a very good practice, which I feel should be inculcated from a young age.
Okay, so also, doctor, like, we believe that I think, going to the dentist should not only be about, say, tooth extraction or pain or infection. Tell us about the importance of, scaling and polishing and why and when should a person get this done?
Again, so scaling, polishing is something like a teeth cleaning professionally जो हम करते हैं dental clinic में. It is very different from the brushing. Okay, no matter how well you brush, we are eating, drinking every day. हमारे दांत पे deposits होते ही है, and that is the first stage of many dental problems. So उससे your gums get inflamed, उससे they move away from the teeth, you have mobility in your teeth, infections, all these things start when you never get a dental cleaning done. So if you maintain a regular cleaning, it makes sure कि आपके gums healthy है, कोई deposits नहीं है, it will make sure your mouth is healthy, and it prevents further problems. So it is very important to get a regular cleaning and polishing done every 6 months for
Okay,
everyone.
okay. So, doctor, we've got some questions also on our chat. Like someone's asking, being above 60, and there is sensitivity in the mouth cavity, especially chili when you eat something chili, and and it's very frequent. So, what would you advise to them? What should they do?
Okay, so there are two things. See, so as we age, हमारी body change होती है. As I mentioned, हम सब cleaning नहीं कराते every 6 months. So our gums with time they move away or down. Okay, away from the teeth surface. That is the beginning of sensitivity. Also, the
Okay.
second thing is we also have a habit. हम बहुत जोर जोर से brush करते हैं, बहुत force लगाते हैं. We wear out our teeth. That is very commonly seen, especially in the elderly age group, and that also leads to sensitivity. What ideally should be done is, अगर COVID नहीं होता, you should visit your dentist, get it assessed. उसकी कुछ fillings होती है, some repair work, cleaning work of the gums can be done, which gives relief. If you
Okay.
cannot visit your dentist, there are some hypersensitivity के लिए कुछ over the counter toothpaste है, which are easily available, like Sensodyne, Colgate Sensitive Pro Relief. You start using those, and those should be used for a period of time. In one day by brushing with them आपको relief नहीं मिलेगा, but yes, over a period of time you will get some relief.
Okay, so you suggesting it's like a constant process, right? That you have to not, wait for a toothache to come in to pay
Yes,
attention to your teeth.
yes,
Yeah.
yes.
So, like a lot of people are also saying that, they use neem datun and stuff like that. What are your thoughts on that? Water gargling, swishing for oral health. What are your thoughts on that?
Okay, so firstly, see, दातुन is basically एक नीम का branch होता है जो उसको वो chew करते हैं, ठीक है? Now that this roots back to Ayurveda. Okay, now I am an allopathic doctor, तो मेरे को ये चीजें बहुत अच्छी समझ में नहीं आती है. तो I don't
Okay.
advise my patient that take a hard branch and chew on it, because at the end of the day there is no control. You will end up damaging your teeth more than doing
Yeah.
anything else. According to ADA, now you should not even use a hard toothbrush. You should use a soft toothbrush, जो आपको हर
Okay.
2-3 महीने में change करना है. Because after a while, using a hard toothbrush and scrubbing your teeth, you will cause more damage than good. So,
Okay.
and things like datun, dental powders I do not advise my patients to use that.
Okay, so doctor, now I'm going to just bring back the conversation back to oral health during COVID. Tell us, like, if someone has a COVID infection, like we've got people asking, or the infection is everywhere, they can't go to the dentist, but you desperately need a root canal. So how safe is it to go visit a dentist, but when it's actually an emergency?
So, okay. So, see, when you need a root canal, that means you have some form of dental pain. And dental pain is very bad. Okay. So, there are only two ways to deal with it. One is, if you're very scared and आपको नहीं जाना है dentist के पास, you start on medication. Talk to your dentist. They will prescribe some medicine, some antibiotics that will take care of your pain. But it is also a good idea to get that dental infection treated. Because as I said, an oral infection can lead to worsening of your COVID. Okay,
Yeah.
so obviously in the middle of your COVID infection, you cannot go to a dentist, then you're spreading it. But
Yeah.
yes, if you are okay, you have to make sure that the dental clinic that you're going to is following all the protocols. Like we have, we try and maintain as much social distancing as we can. We only see 1 or 2 emergency patients. We screen every patient. We also, advise an RT-PCR 72 hours before the appointment. So if these steps are taken and proper barrier technique follow हो रहा है, तो आप emergency के लिए तो जा ही सकते हैं. So,
Okay. Okay. And doctor, like, anything else that you would suggest for people to take care of? If say, for example, if someone's COVID positive, how do
जी.
they take care of their oral health? Because they will also be on medication at that time, right?
Yes, yes. अगर आप COVID positive है and you're on medicines for that, okay, few things to remember. पहली चीज, as I mentioned in the presentation, आपको dry mouth होगा. जो कई drugs जो COVID में use करते हैं, उसका side effect is dryness in the mouth. So please stay very well hydrated. ये बहुत जरूरी है. If our mouth is dry, it will lead to cavities, infections, and many problems. Dry mouth is also the root cause of many other problems. Secondly, आपका oral hygiene should be very good. Thirdly, you should regularly keep an eye कि आपके mouth में कोई swelling, ulcer कुछ भी आ रहा हो, to treat it at the earliest. Don't wait for 15 days of your isolation and then go out and get it treated. तब तक it will become much worse. You must change your toothbrush. अगर आपको COVID हो गया है तो once you're
Yeah.
out of the isolation, you're better. Please, throw away that toothbrush. It's highly infected.
Right.
So, these small things you need to take care of. And of course, post-COVID also, please, if you are a diabetic, आप steroid therapy पे थे, keep an eye on the mucormycosis, what I had mentioned. So, these are important.
So,
Great,
doctor,
great.
a lot of sorry, Ankit. A
No,
lot
please
of
go on.
children, a lot of children are also getting affected with positive in this wave. So,
Yes.
do the same rules apply to children as well for oral care, or do?
Very much, very much. बच्चों के साथ तो you have to be more careful. Obviously, I think children will have one parent or someone with them taking care of them at all times. So their diet, their sugar intake, their brushing, oral hygiene, everything has to be taken care of. They are as susceptible as an adult.
Right.
Yes.
Okay. So, Dr. Gagi, so if we say 5 take-home messages for our viewers today, so what will those be?
Okay. As I always say, please take care of your oral health. Do not neglect it at this time because it's even more difficult. Like you cannot go to a dentist easily. अगर कोई आपके mouth में infection है, do not ignore it. अब हो गया infection, abscess हो गई, you will have to get it treated. Talk to your dentist at the earliest. If he or she prescribes medication, please take them. If required, if it is an emergency, it is better to get it treated than letting it की mouth में वो
Yeah.
पड़ता रहे. Thirdly, stay very well hydrated. अगर आपको dryness है mouth में, throughout the day, make sure that you're taking fluids. That is very important. Um, if you have had COVID or you are going through it, make sure कि आपके your brush, floss, your tongue cleaner, everything is separate. And of course, you'll have your separate bathroom and discard everything after the infection. Make sure your diet is healthy. You have a good source of calcium, minerals, so that as good as your immunity, your mouth will be that healthy. That is.
So great. Thank you, Dr. Gargi. Thank you for joining us today and imparting us with all this amazing knowledge about oral health in current times. Ritu, if you can share Dr. Gargi's certificate over here, please.
All right. Thank you so much, and thank you for having me. And so happy to be here.
Thank you, Dr. Gargi. Okay, guys, that will be all for today. We will be back tomorrow at 7 p.m. with another edition of Med Talks with Dr. K.K. Agarwal. Keep watching. Namaskar.
Thank you.